All right, thank you everybody. Can you hear me okay? Perfect. And if you could see my screen, I'd like to just quickly introduce myself, and I also have Dan Hickman on the line. Sorry, here we go.
Sorry, I was muted, Kyle. Good afternoon,
right.
or good morning, everybody.
So Dan and I work for ProModel Corporation. We're based in the United States. We're here to talk to you a little bit about FutureFlowRx and how we use this simulation platform for decision making during a crisis. There's a quick agenda here. We're going to talk about a little bit more about ProModel. We'll get into digital twin definition, talk about some accurate census predictions and operational strategic analysis. So again, my name is Kyle Kester. I'm a professional engineer. I've been with ProModel for about 10 years. We do simulation modeling, so we'll show a few of these concepts and what we've done for a lot of our customers in the healthcare space. Dan, you want to give a quick introduction?
Yep, I'm Dan Hickman, Chief Technology Officer at ProModel Corporation, one of the primary architects on the product that we're about to show you, industrial engineer by trade, and looking forward to sharing with you what FutureFlow can do.
So again, thank you everybody for the presentations earlier. We've heard a lot of great things, and one of the things I'd like to do is try to pull some of those together. I heard some concepts around changing in operations, maybe adding in ICUs. I heard things like surge capacity, patient flow. We try to take a lot of that into consideration. And when we talk about a digital twin, the simplest analogy I always give is think about when you're using a Maps app and you're in a place where you don't know how to get around. You know, the digital roads and the virtual roads that you see, if you're trying to get from point A to point B, you'd put in your destination. You know, the Maps app would guide you through, and sometimes we just blindly listen to the directions and trust that it's going to get us where we need to go. Think about FutureFlow being that Maps app for your patients to flow through the hospital. We'll talk a little bit about how we configure this digital twin being a virtual hospital that allows you to test and try any of the strategies and changes that you can anticipate to understand what kind of impact it's going to have on your resources, equipment, or just general patient flow for outcomes as well. With the goal being that just better decisions faster. We understand in a hospital setting that focusing on the patient, and Julie had a great way that she put it earlier about a patient-centric model. That's really how we think of our simulation software as well. We build solutions from the bottom up, from the patient up, so that we could put the focus on the patient in our models so that they act and react as they would in real life, allowing the decision makers to spend more time with their patients and not on all the decision options that they're presented with every day. So very quickly, a little bit about ProModel. You know, I won't read all through this, but we have about 130 direct and indirect employees. We do have some international representation as well. We've been doing healthcare simulation for nearly 30 years. The list of products is up here to the right. I'm going to just briefly show MedModel and ProModel just to show how we've progressed our career through our traditional software, and then really spend the majority of the time focusing on FutureFlowRx. It's our newest platform where we've taken our experience building these custom one-off solutions for hospitals for nearly 30 years, and then incorporating in a lot of our expertise that we've designed around our custom applications that are more web-based, a large number of users, more interactive. We've combined those two platforms to create FutureFlowRx. It's fairly new. We're about 3 years with FutureFlowRx with some development time before that, but we currently are installed at 3 of the top children's hospitals in the United States and getting some great use out of it. So one of the key things that I like to talk about simulation, if you're not that familiar with our brand of simulation, I think in hospital settings, you're more familiar with when customers or when your patients are being, when you have to train new nurses and when you have to train different things. You have the physical simulations where you can work on you know, the dummy dolls and understand how to, where everything is going to be, and you get that familiarity from a physical simulation standpoint. We try to take a similar approach in a virtual world as well. So the reason why discrete event simulation has its benefits, and there's many different approaches, and we understand and we will defer to some of these others when it makes sense. But in a hospital setting, we do feel that because of the increasing variability, whether that's patient arrivals, length of stay, discharge patterns, or it's the interdependencies where there's shared resources, nursing, EVS, oxygen tanks, all those kind of things. Simple Excel models can answer some questions. Monte Carlo simulation, if you've heard that, is great to answer some questions when you have just variability with low interdependencies. You can use statistical models, mathematical algorithms like linear programming to answer some of those other complicated solutions. But it's really the convergence of the interdependencies and the variability that when you get to that complexity, discrete event simulation is the superior, it's superior to mathematical algorithms. And really, one of the things it can do is it can leverage the current state of the hospital. So that's a huge benefit of what we can do in FutureFlow. So I'm going to just quickly show this graphic, but I'm going to jump out of the slides for a second and show it being animated. This is our ProModel med model type application. If you haven't seen this kind of thing, it's like ripping the roof off of your buildings, your hospitals, and we could zoom in. And the most important thing to show here is that we do model every individual patient moving. We can have all the different patient types by their service required. And again, what we've done for years is this type of solution where we come into a hospital setting, we understand what their inputs are, all the floor layouts and space. And I think one of the things that was said earlier in one of the presentations around oxygen tanks, these types of models could be spatially aware, so we can make the paths that patients and resources and oxygen tanks and everything flows through this hospital so that everything moves in relation to speed and distance, and you can have physical constraints. I've worked with a lot of hospitals this past year through COVID where physical distancing has become a very important issue. And we can build those kind of things in these solutions so that you can have the comfortability that, if you install elevator policy changes that only one family can be on, for example, that you're going to have the comfort level that you're not going to have people waiting up or queuing up too much, and changes in simple policies, what kind of impact that's going to have downstream in your process. So I'm going to shift gears and we're going to talk more about FutureFlow at this point. And this is an actual use case that we did for one of our customers. Oops. So FutureFlow is a web-based platform. I think the most important thing is that it's an always ready model. It's connected to whatever systems you have for your electronic health records. We can receive data every hour, so it's continuously running simulation models and trying to provide more of the operational insights. I'll show you in our dashboard in a moment where we can do +4, 8, 12, 24-hour predictions. But for this example, when we were working with one of the large children's hospitals in Colorado, they're a 5-campus system. What we were trying to do when we initially were contracted to work with them was to help them predict how they're going to get through flu season. We started in last September. We were working very close, and then obviously in the States here in March, everything started to ramp up with COVID, and we shifted gears and we turned this more into a strategic analysis. So this is just a quick view, but it does highlight a lot of different points that we can do and what we've done to analyze during during COVID, but it also, I'll get into a live demonstration of how simple it is to use the tool and how we could use it for things like flu season or any upcoming events that you'd anticipate. So what we're showing here is in all of our tools, we have this what if scenario analysis area. It allows us to play any types of games on the system where we want to evaluate different future states of the hospital. So the example in children's hospitals in the States here were not as impacted, obviously, with the children having COVID. So what they felt they can do is they were trying to develop their emergency and strategic plan to present to the governor on what they can do to alleviate some of the capacity constraints that were anticipated in some of the adult hospitals. So we were able to work with them because they had FutureFlow already installed and we have had all the historical patterns. We were able to quickly spin up a strategic analysis that helped them evaluate, increasing a certain patient type. It also, we were able to target patients under 18, 21, 25, and 30 from all the other hospital systems in and around the state that they were in. And what that allowed them to do was evaluate if they had to take transfers from those hospitals into their system, up to certain ages and varying ages, and also from different, like there was a large system that they were evaluating to include or not. We ended up running about 30 different scenarios, and we kind of pared it down to a few, but it was what they used to develop their strategic plan and present it to the governor for approval as well. And really in the bottom, what we're showing here is the scenarios that we defined and have checked will all show in a side-by-side comparison. So on the chart below, I had to hide the numbers here, what the capacities were, but the purple line at the top is showing capacity over time. The x-axis here is showing what it looked like from March all the way through September. They already knew they were going to open up units, and just like I've heard in some of the previous presentations, some of the ICU, the tents and the things that were put up, if you know you're going to open up beds or feel you need to, we can build that into a model that shows at the correct time when they would open up. And again, the different graphs here, what that's showing is the volume of patients that on top of their demand that they had, which is the baseline at the bottom, we selected some scenarios. We're showing the under 30 and the under 18, and then with and without the One Health system. But what this allowed them to do was just evaluate strategically over time. And it's very hard to plan for the unexpected, but making the assumptions, they felt more confident in the plan and their assumptions that they felt better prepared for what could potentially happen. And the story goes on with them and what we're doing. Once we built confidence in accurate census predictions, we're able to layer in staffing ratios, and I'll show that in a moment. And then also we open the door to doing some PPE analysis as well. As you mentioned in previous presentations here, when policies are changing or if things are happening where you start to reuse PPE, or if you have a shortage and you have to make some changes, those changes that are made on the fly do have some impacts down the road. And what we can do is show PPE related to census predictions at the unit level or the resource level, and show how a change in policy might impact your on-hand quantity or safety stock and things like that. So at this point, I'm going to shift gears. We're going to get into the tool. I really want to stress just how easy it is to set up a digital twin and show how easy this can be. Just doing a quick time check. So one of the things that we can do in our tools is that we run over time. And one of the benefits to running over time is we could also change some of the historical impacts that we would observe. So for example, what we're showing here is just a few different patterns of how case mix and your service levels. We're going to focus on hospital medicine and critical care. They were the two highest ones in these examples. So what we can do is we could run a model here where this one's running from June to March in the upcoming year to evaluate the different case mix and seasonality service mixes here. So we can have a probability of what a patient would come in if they're going to be in the summer season. We have a summer shoulder respiratory season. And then really the focus of our analysis that we're doing with a customer right now is looking at different flu season options, high, medium, and low, with the expectation that we can adjust all these parameters. And if they want to put in a COVID example as well, we could also redesign their future hospital to have an isolation unit virtually. And it's easy to do that in a matter of minutes. We can redesign the patient flows so that all respiratory illnesses go to that specific isolation unit as well, and really give our hospital customers the confidence that the decisions they're making are going to be impactful and they have plans prepared for it. So at this point, I'm going to get into a quick demonstration. Digital twin, we're going to show the accurate census predictions and then that example. So again, FutureFlow is a web-based platform. We set this up in most of our customers, and really all of our customers, I apologize, right now are set up so that the server is behind their firewall, so there's no compliance issues with data being transferred. We can configure that information, and really what you get is a platform that you could analyze from two different aspects, operationally and strategically. Depending on how big your hospital system is, we can have all the systems in here as well. Again, most of our customers right now are single standalone children's hospitals, with the exception of the one is a 5-hospital system. So we could show in a panel what your entire system looks like. We are talking to some large US systems right now that might have 30 hospitals, or maybe it's a national healthcare system where you might have 80 to 100 or more hospitals. This could be configured so that you see it in that type of view where you can look at the entire hospital with the ability to quickly filter down to a single hospital and understand all the key important information. So for example, I'll just focus on one card here. If we're looking at our census, every hour we get a data feed from the electronic health record systems, and we can show that at 8 a.m. we had no kidding, 349 patients, that's heads and beds. What we can do in our software is take that, and in a simulation environment, we run many different replications is what we call it. And that's basically just alternative futures. Because there is variability in the patients, we could run many, many times and then understand how the model would predict and show in some of these histograms what the predicted future could look like in terms of census predictions. We have the ability to go to the hospital level. We even have the ability to go down to individual units as well. So that's the quick overview of the dashboard. I'm just going to get through a few quick screens here and then open it up to Dan and others for questions. Really, the definition of the digital twin is we need to come in and understand the size, shape, everything of your hospital. So we can identify all the different units, what the capacities are. If we come down again, I was clicking on this one before, we could look at the PICU and we can input what the beds per staff would be, and we could put the staff ratios in as well. When we go through our retrospective analysis, sometimes we'll take 3 or plus years of a hospital's past data, try to fit that data so we understand, how patients arrive by day of week, by hour of day. We fit your arrival patterns for the different admit sources, typically direct admit, emergent, or OR, but it could be just about any. And then again, I showed the flow classes before on the previous slide. We can make these time dependent as well. So if you have a flu season, or if you wanted to compare how would your hospital react if it was 2017 versus 2018, we can have those different flu seasons installed so you can see what kind of impacts that would have on your hospital. We could do the same thing for discharges. So, the goal of this being we're trying to build confidence for anybody looking at this that we understand from when the patient admits to when they discharge. We have a very important process of how we determine how patients flow through the hospital as well that I won't go into today. But what we do is we're also fully transparent with our predictions. So just like on the dashboard when we showed the +4, 8, 12, 24 hour type predictions, we also surface that for our customers so they can build confidence. Whatever we predict, just the takeaway from this slide is that we, in full transparency, can show that our hospital digital twin here is predicting accurately within the +4, 8, 12, 24, 36 hours. And you could see, for example, that 80% of our predictions are, it's a demo data set, but this is very well representative of our other customers as well. It's predicting within 1.5% to 2% of the accuracy at the entire system level. And again, we could surface that at the hospital down to the unit level as well. So very similar to what I showed before. If we were looking out and we wanted to look from June to March of next year, and we were looking at flu season, the slide that had the different flu seasons of low, medium, and high, we can quickly customize a tool like this with little effort and show maybe this is what the baseline of the hospital would look like in terms of census for the entire system. I can quickly filter this down to individual hospitals as well. And one thing we often do is we can compare side by side. So you could see if we expect flu season to be very high this year, we start to see that at the capacity for the hospital 2, we're up against the capacity line. One thing we'll do in a lot of our simulation runs is run it unconstrained. And what that means is that if a patient requests a bed or would be preferred to be placed in a bed in that hospital, we don't hold them up. Otherwise, they back up into an ED hold or some type of holding pattern. But we could run it unlimited. It gives you an idea in these tools, what kind of capacity you would require. So this might be helpful if you're trying to size a unit or things like that to understand, how much capacity would be available. And the last thing I'll show is just that again. Yes.
Yeah, I just wanted to let you, I mean, we don't have that much time. I think we really want to
I
have
understand.
some questions at the end, but the last thing, great.
Yep. Last thing I'll say here is just, we can layer on all of these scenarios. So like a low, medium, and high flu season, and you could see, I'll go back up to the entire system level. You could see how they kind of navigate through each other here, and you can get a sense of where your capacity is going to be. If we look at the staff types, for example, this is where we are with one of our customers. We're trying to help them evaluate what their strategy is for resource planning for next year, and do they need to, is it overtime, is it travelers, is it what type of nursing and resource strategy do they need to employ? And because we have the staff ratios and we have accurate census predictions, we could relate those to nurse staffing, for example. So I'll leave it there. I appreciate everybody's time. We're open to discuss this further, or if you have any questions or would request a simple demonstration, feel free to reach out to me. Happy to do this, and anything we could do to enhance the patient outcomes in healthcare is our goal. Thank you very much for your time.
Thank you so much, Kyle. Thank you, Dan. I know you're there in the background as well.
Yeah, no problem.
Yeah. Listen, fascinating presentation, and I'm going to use kind of chair's privilege here to ask my first question.
Okay.
You gave examples there from flu season, which is of course really important to hospital organizations. It's a major issue every winter in different parts of the world. To what extent do you think you could adapt what you've got to look at very rapidly, I mean, of course, I'm thinking about COVID here, but very rapidly emerging situations where the pathology of the disease is not so well understood, and you can't be sure when you're going to see peaks and drops in demand?
Yeah, we went through this with some of our children's hospital customers, and we don't know exactly how it's going to react, how long patients are going to stay. But what our tool gives them the capability to do is adjust what those potentials could be. If it's as severe as they expect, they could adjust their patient routing so that patients stay longer. And we could isolate. We did this exactly where we created an isolation unit. We were able to quickly configure patients that have a certain diagnosis to go to that isolation unit, and understand that if they make policy decisions, what kind of impact is that going to have on their census, their staffing, their PPE in a tool like this.
I'll jump in there and add a little bit too. So of course we have limited time, but the key to our model is capturing all those different system dynamics that exist in real hospital operations. And I always say there's the big three, and your question falls right in line with the big three. It's, how do you drive the demand that's going to go into the hospital, which the demand would be representative of how many per day, when they arrive per day, and then who are they creating when they go in. And so like Kyle said, we're with the COVID flu scenario that we've been working with, we didn't know what those peaks and valleys would be. So what we did is we worked with the very intelligent people at the hospital. We looked at 2019, we looked at 2018, and we just, we had a tool that could take 10 different versions of that with that institutional knowledge and say, well, I'm Dan, right? Dan had an idea. Well, I think it's going to look like this. And Jonathan, he thinks it's going to look like this. Well, let's play that out. Let's see all the different combinations of how this, we demoed it as a high, medium, low, but in reality, at the real use case, there was much more than 3 different versions of what the future might look like. Yeah. So we just needed the ability to plug that in and see how it would play out, but representative of real flow, real dynamics, real length of stay, it's historically driven. So hopefully that helps.
Fantastic. Yeah, it does. Thank you very much. Listen, we're just about at the point where we have to end, so I'll say goodbye to both of you, and thank you again. Fascinating presentation, much appreciated.